leg, kalau limbs, kalau macam dia adalah device yang untuk nak luruskan kaki and what not lah. Okay. But normally sometimes sometimes macam untuk physical activity, if we want to talk about most of the patient, kalau dia ada the consequences, sometimes they also experience weight gain kan. So kalau patient yang ada weight gain, untuk dia punya management, kita akan bincang dengan PT dengan that personnel yang fit dia punya limb punya device macam tu lah, untuk supaya dia boleh buat physical activity. So these are the list of conditions. Kalau macam neuro rehab, basically neuro rehabilitation is a condition where it involve traumatic injury lah, kemalangan and what not lah, TBI, stroke, spinal cord injury. Kalau neurodegenerative, dia involve is due to the degradation of dia punya nerves ke, ataupun dia punya nerves lah. Okay, right, like Parkinson disease, dementia, Huntington disease, a lot of disease lah, Myasthenia Gravis, Guillain-Barré, all these conditions. So basically this is the summary of nutrition implication of brain injury. So you tahulah the role of brain kan. So brain then connected to kita punya spinal cord. So all the nerves, different cranial nerves, dia ada control different functions kan. Apa nerves yang you ingat daripada banyak-banyak nerves yang ada tu masa you belajar dalam anatomy and physiology? Yang paling lah mungkin related to nutrition and dietetics. Saraf yang kontrol kita punya GI punya mortality and functions. Tak juga. Tak ingat juga.
Vagus nerve.
Yelah kot, buka lah buku kan. Alright. Saraf vagus, saraf nombor berapa ya? Kena carilah. Okay. Some are directly involved kepada dia punya nutrition implication. Some due to, for instance, like this perception and cognition kan. Kalau macam visual, mungkin it's not directly menyebabkan muscle wasting and what not. Tapi because of dia ada visual impairment, dia tak nampak kat mana makanan dan sebagainya. So they tend to have limitation in terms of dia punya accessibility kan. Spatial punya ability. So kalau macam dia nak suap makan, so dia tak boleh to control dia punya the distance lah between makanan. So dia susah nak ambil makanan yang berbentuk lebih kecil dan sebagainya lah. Okay, memory, it can be daripada both, it can affect both neuro rehab and also neurodegenerative lah. Kalau neurodegenerative, in some types of neurodegenerative, dia memang ada this deterioration of memory ability kan, macam dementia, Alzheimer semua tu, Parkinson disease. So dia punya memory will affect dia punya meal timing dan sebagainya lah, tak ingat nak makan. So kalau macam communication kan, dia menyebabkan ada communication disability. So dia tak boleh nak request makan, nak bercakap, tak tahu dia lapar ke, kenyang ke, tak boleh nak communicate. Eating behaviour become antisocial because of the condition. Physical and verbal abuse, disinterest to food, ataupun you biasa dengar kan, kalau orang tua kata dah tak ada selera nak makan, dah tak ada minat nak makan, is due to this degenerative punya issue lah. kalau masa muda-muda tu boleh makan 2-3 pinggan, bila dah tua dia jadi kurang lah appetite, physical ability to eat, yang ni tadilah. Okay, psychological issue, emotional, jadi cepat marah. So orang tanya nak makan apa pun marah. Kemudian makanan tu probably because of dia punya taste changes, so dia tak boleh nak rasa, makanan tu jadi tak sedap, so dia jadi agitate lah. Okay. Okay, first section about neurologic disorder from trauma. Number 1 is traumatic brain injury lah, any injury that involve dia punya brain. Ada primary and secondary. Primary is directly involved that brain injury. Secondary is because of resuscitation, transportation, surgery, critical care unit. For instance, like stroke. Okay, so because of delayed resuscitation, so dia ada prolonged inadequate blood supply kepada dia punya brain. So daripada mild dia boleh jadi severe. Okay, so this secondary brain damage, we try to minimize dia punya prevalence lah. Okay, it's preventable. Ni contohnya kan kat sini kan, because of that resuscitation, okay, ataupun dia punya procedure. Kalau yang primary is due to that directly involved kepada organs or the brains lah. Okay, so slide ni nampak macam blurry sikit. So dia ada dua lah, non-traumatic. Kalau dalam brain injury ada non-traumatic and traumatic. Non-traumatic tu is anything not due to direct injury macam tadi lah. Okay, macam anorexia, infections, because of dia punya infection. Contohnya macam meningitis kan. Okay, daripada bakteria ataupun fungal meningitis, dia lead to kepada the damage of that brain cell, so boleh menyebabkan brain injury lah. Okay, tumors, metabolic disorder. So like tumors is not a trauma punya incident lah. Okay, kalau yang traumatic tahulah daripada these are the causes lah. Kalau traumatic can be from accident, road traffic accident, falls, ataupun injury, ataupun being hit by someone or anything. Workplace injury boleh berlaku kat mana-mana je, or sport injury kan, macam boxing is prone lah, any sports actually prone to injury. Kalau macam main yang you rasa macam safe, tapi it can be severe juga kan. No lah, tak ada. Semua aktiviti tu dia, you kena buat the risk analysis lah. Semua aktiviti tu jangan buat seronok sangat, so dia ada risk lah. Okay, the principle kalau acute injury is according to that stress response and metabolic stress response to injury lah dalam critically ill kan, that we have discussed earlier. Post-acute effective nutrition support to address nutritional depletion during that critically ill to regular evaluation and monitoring, manage EN complication kalau adalah, liaise with speech language therapists or speech pathologists for transitional feeding. Rehab dia punya chronic phase after that injury. So biasanya kalau melibatkan neurological injury or disorder, most of the cases involve this rehabilitation lah, maksudnya chronic. Nutrition assessment is important, so kena monitor frequently adequate nutrition requirement and correct any persisting nutritional depletion. Kena intervene as soon as possible. Assist with disordered eating, kalau ada masalah dengan eating disorder. weight management, so kena monitor lah. So achieve ideal body weight to prevent muscle wasting, ataupun kita beside muscle wasting, the other the one end of extremism. So kita nak prevent juga the prevalence of weight gain ataupun overweight lah, because most of the time kalau rehab patient ni, they require assistance kan, dia tak boleh berjalan sendiri. So berat badan pun tak boleh lebih lah, sebab you need someone to move the patient daripada katil nak pergi mandi dan sebagainya. So kalau patient ada masalah overweight pun another issue ataupun problems kepada caregiver kan. Kena nak kalau macam case, kalau you ada baca, kalau biasa keluar feed dekat suggestion punya, dekat you punya TikTok ke apa kan, there's one mother, dia carry berapa berat anak dia tu, anak dia ada mental disorder, so dia carry. Tapi yang ni case dekat, I can't remember India atau mana, tak nampak dekat TikTok. Okay, so the apa tu, sacrifice of mother kan. Okay, anak dah daripada berat 2.5 kg kepada lebih daripada 90 kg pun kena jaga. Okay. Nutritional management during acute injury phase, yang ni sama macam catabolic hypermetabolism punya management lah. Of course dia punya calorie requirement is increased, can be up to 160%, but you know that at phase is not it's shorter, depends on severity, it can be up to 5 days. Nitrogen requirement about NPC to protein ratio. Okay, TBI induces hypercatabolic state resulting in high nitrogen losses. So kena make sure dia punya protein requirement is dia punya protein supply is adequate. Okay. Fluid and electrolytes, maintenance of cerebral perfusion pressure and intracranial pressure. So fluid resuscitation and hydration status is also important. Fluid and sodium disturbance can lead to syndrome of inappropriate antidiuretic hormone. Okay. Neurological trauma leads to diuresis, kena increase rate. So this condition will increase the risk of reduction in many electrolytes lah, magnesium, potassium and also phosphate. Nutrition support in acute phase should be start within 24 to 48 hours of hemodynamical stable. So hemodynamical stable is when dia punya vital sign is stable, normalized, and dia punya fluid hydration status is consistent ataupun stable. Okay, then only kita akan start dengan nutrition support. Hypermetabolism may persist after being critically ill dependent on severity of cases. So kalau macam dia melibatkan open surgery compared to open injury compared to kalau close surgery kan, kalau skull ada crack and require removal of dia punya skull plate, so mungkin dia punya catabolic state is longer compared to kalau close injury. So accurate body weight can be obtained. So as we discussed in critically ill, the gold standard at the moment is indirect calorimetry, but not any institution afford to have that equipment lah. Dekat Malaysia ni lagi limited. Okay. So again, this is the nutritional consequences ataupun problem related to neurological issue ataupun condition. macam tadi lah, altered consciousness. Kalau in TBI, the prolonged TBI cases. So kalau unconscious, definitely nutrition support via artificial nutrition support guna tube feeding is the only mean of delivering nutrient lah kepada patient, kan, memang dia tak boleh swallow dan sebagainya. Dysphagia, kalau patient yang improve, they can transit daripada EN to oral, but most of the cases pun dia ada melibatkan dysphagia, so kita kena modify dia punya texture to prevent daripada aspiration and what not lah, infection to the lung dan sebagainya. Distortion of smell and taste, yang ni lah ada perubahan. So GI intolerance, kalau dia melibatkan nerves yang control dia punya bowel function. Persistent regurgitation, kalau again sama juga, kalau dia punya sphincter is weakened, kan, so dekat kita punya alimentary system ni kan ada sphincter yang dari esophagus ke stomach, kan, so kalau boleh menyebabkan ada complication lah, GERD dan sebagainya, bowel dysfunction. So yang ini ada kaitan juga dengan TBI, dengan surgical issue, macam dia require that stoma bag and what not to make artificial route, kan, untuk dia punya defecation lah. Okay, 60% of brain injured patient comments below 90% of ideal body weight. Okay, so this weight punya issue. Average loss between injury and rehab is quite significant, 13 to 15 kilograms. Identify and correct nutrition depletion during the intervention during critical state is important, as well as correction lah selepas or during that rehabilitation phase. Neurological damage can have profound effects on physical and mental capability, including behavior, ability and food consumption. Okay, so yang ini pun ada kaitan dengan long term punya management lah. Secondly is stroke. Mungkin stroke you dah cover dalam hypertension, types of stroke and what not. The prevention of stroke mungkin ada kaitan dengan how it control hypertension, kan, dash diet dan sebagainya lah. Okay, so stroke, the acute phase, the initial injury is considered as critically ill, dan tapi kalau the bleeding or hemorrhage dah stop, so dia akan masuk ke flow phase, kemudian ke rehab phase jugalah. Okay, so basically stroke dah tahu dah, there are two types of stroke, kan.
Betul, sir.
Dah tahulah, kan. Alright, yang ni saya boleh skip lah. Satu is hemorrhagic, maksudnya that blood vessel burst, ataupun this ischemic stroke, dia punya blood clot ni dia dislodge dari mana-mana kita punya vein, kan, then dia pergilah, termasuklah ke small artery dekat otak ni, so dia boleh block kat situ. Okay, so this embolic yang tadilah yang ischemic, and also intraparenchymal hemorrhage ni yang commonly lah dekat mana rupture tu berlaku lah. Okay, so causes semua dah tahulah, dia punya etiology of stroke. Mostly it boleh preventable, like smoking, alcohol and what not lah. Okay, the primary prevention of stroke, management of kita punya blood pressure, smoking cessation, control blood sugar, supaya blood vessel damage is reduced. Okay, kemudian encourage on Cardioprotective Diet, basically is a DASH diet lah. Okay, Management on admission during the acute phase. So what is the assessment yang kena buat, and also after admission ataupun during rehab proses lah. Sama juga macam ada brain injury ataupun ada macam brain injury tadi. Okay. Alright, yang ni pun sama juga, acute kena intervene as soon as patient is stable. Okay, kena start dengan nutrition support, kena assess dia punya swallowing ability, tengok which brain area that affected. So sama ada melibatkan dia punya speech ataupun swallowing dekat oral punya bahagian. Okay. So yang ini untuk rehab, no hypermetabolic response during that dia punya recovering phase lah. Okay. Again, this is the possible neurological impairment. Yang ini daripada stroke punya notes lah. But all neurological disorder boleh it can occur lah in any neurological punya ni, macam tadi lah perception ni pun ada, apraxia, aphasia, okay, ada kaitan dengan feeding tadi, okay, dysphagia yang you dah discuss dalam previous therapeutic diet lab. Nutrition support sama juga, initiation within 7 days post-stroke, reduce case mortality. Yang ini specific in stroke patient. Tapi kalau dia admitted to critically ill, once stabilized between 24 to 50 hours, we have to start feeding on patient. Spinal cord injury, the extension yang tadi melibatkan brain, now the spinal cord. Okay. So these are the causes, samalah, accident, fall, act of violence macam tadi lah, apa tu, attack dan sebagainya. Sport and recreational injuries, diseases that located macam tadi, tumor pun boleh brain injury. Kalau tumor tu berlaku dekat that spinal cord area, can cause this injury if dia compress ataupun apa tu, dia put pressure on the nerves dekat spinal cord. So akan tengoklah which part of dia punya spinal yang control to which functions kan. Okay. Ability to control limbs after spinal cord injury depends on 2 factors: the locality of injury. So maksudnya dekat spinal cord kan ada kita punya daripada different parts of kita punya spinal cord, lumbar sampai ke bawah sekali dekat sacrum kan. So cervix, thoracic, lumbar, sacrum kan, daripada atas ke bawah. Okay. And also the severity lah, how severe dia punya injury. So it will affect sama ada dia complete atau incomplete. Complete maksudnya there's no sensory at all, ataupun incomplete lah, dia just a small punya sensation loss, ataupun another classification, it depends on dia punya either tetraplegia ataupun as known as quadriplegic ataupun paraplegic lah. Sama ada is only upper limbs or the whole 4 limbs involved ataupun affected lah. Kalau tetraplegic ni memang totally paralyzed lah kan. Okay. So sign and symptoms of spinal cord injury, it can be from mild. So kalau mild tu maksudnya contohnya kalau macam I'm not sure whether you pernah main tak permainan ni, ataupun maybe your generation tak adalah main yang ganas kan. Macam dulu-dulu kalau when I was in boarding school, kalau macam kita duduk ataupun kita tengah duduklah biasanya, dan suddenly kawan kita akan compress kita punya, kita punya, tekan kita punya dada kan. So it will lead, there's a case dia involve that spinal cord injury. My friend kena that spinal cord injury lah. So daripada bergurau ataupun permainan yang tak terkawal ataupun yang bukan-bukan can lead to that injury. So mild kepada severe, so as mild as loss of movement ni quite severe lah. Loss or altered sensation including ability to feel heat, cold and touch, ataupun kalau macam you ada lower back pain pun kadang-kadang that you rasa macam lower back pain sampai you macam contohnya macam you sakit lutut, macam lutut you quite stiff, nak bengkok susah, duduk antara dua sujud susah, you think is because of your knee punya problem, tapi it can be due to dekat kita punya sacral punya nerves lah. Okay. Loss of bowel and bladder control, yang ni pun sama lah. Kalau macam incontinence, normally prevalence among elderly kan 45 and above, tapi at the age of 20 pun you ada masalah dengan control, nak control urination ataupun incontinence lah, kencing tak lawas macam tu. So kena check lah, mungkin ada non-trauma punya isu lah, macam tadi lah tumor ke and what not lah. Exaggerated reflex activities or spasm, kalau macam suddenly you punya muscle tu macam dia vibrate macam tu kan, okay, maybe it's a sign lah. Changes in sexual function, sexual sensitivity and fertility, yang ini. Pain or an intense sting sensation caused by damage to the nerve fiber in your spinal cord, yang ni, yang ada tiba-tiba rasa sakit lah. Difficulty in breathing, coughing, clearing secretion from your lungs, okay, tak ada control the force to macam during your coughing kan, ataupun nak keluarkan kahak. Or difficulty in breathing, you tak stress, you rasa you tak stress, tak ada fikir masalah negara, but you have that difficulty kan, kena check lah. Okay, so that is 3 conditions of traumatic neurological disorder, TBI, traumatic brain injury, stroke, as well as spinal cord injury. So dia punya nutritional implication, as we discussed earlier tadi, involve at which site ataupun nerves yang affected lah. Okay. Next is non-traumatic. The first one is yang saya pun susah nak sebut, Adrenomyeloleukodystrophy or ALD. This is a genetic disorder where our body cannot break down this very long chain fatty acid, VLCFA. Okay. So the saturation of very long chain fatty acid akan menyebabkan inflammation dekat kita punya brain and kita punya nervous system. Okay. So if is a rare cases, ialah genetic. Kalau even in Malaysia, genetic disorder even yang common pun, kalau macam apa tu, MSUD ke PKU, ada, but it's very rare. But government take a serious measures lah in managing any genetic disorder. Okay. So this genetic disorder mungkin dah cover juga dalam pediatrics, or I'm not sure dalam pediatric yang on genetic disorder punya topik, but specific to that involve neurology punya functions, so ada juga dekat sini lah. So ada special product combination of this C18 and C22 that can lowering this very long chain fatty acids level lah. So dia punya damage tu akan kurang. Okay. So avoidance is not much effects because dalam makanan tak banyak makanan yang ada very long chain fatty acids, but dia ada endogenous punya synthesis. This BLCFA ni dia synthesize in our body lah. Next is epilepsy. So epilepsy, a disorder of the brain characterized by repeated seizures. So the prevalence is quite prevalent. Ada banyak case of epilepsy. It can be diagnosed as early in young age ataupun during infancy pun. So it's about 40%, then 60% in later life lah. Okay, bila dah besar. So kalau among children and adolescent, dia ada kaitan dengan genetics ataupun inheritance punya issue. Kalau among elderly ataupun adult and elderly is because of other neurodegenerative issue lah. So this seizures is defined as a sudden alteration of behavior due to temporary change in electrical functioning of the brain. So it is idiopathic, tapi dia punya condition they have this electrical punya wave change dekat dia punya brain activity lah yang menyebabkan berlaku seizures ni. Normally the brain continuously generates tiny electrical impulses in an orderly pattern. So dia adalah dia punya rhythm. So ada dua, tonic-clonic seizures and also absence seizures. Tonic-clonic is yang severe lah. So we can see dia punya seizures in longer period of time. Macam absence seizures, dia mild. Sometimes dia punya symptoms sama juga macam kita punya muscle tone, yang repeated muscle tone because of spinal cord injury. Okay, so dia ada dua lah. This is some info. Men are prone compared to women. Children, adolescent more likely to have epilepsy of unknown or genetic origin tadi. But this in elderly biasanya due to brain injury ataupun infection ataupun dia punya neurodegenerative tadi lah. So there are a lot of factors ataupun risk factors that can lead to epilepsy. Okay, premature birth ataupun low birth weight, trauma during birth, dia punya umbilical cord stuck ataupun terbelitkan, so dia ada lack of oxygen, ataupun overdue kan, long overdue, dah overdue tapi lambat bawa ke hospital induce ataupun tak nak induce, so baby dah lemas lah bahasa Melayunya, bahasa kampungnya. Okay, seizures in the first month of life. So kalau you have a baby ataupun daripada your cousins ke apa, kalau first month in infancy dia dah ada one even absence seizures pun kena check lah, kena buat dia punya brain punya electrograph. Abnormal brain structure at birth, so this is high risk lah. So kalau dia punya skull deformity, so biasanya doktor akan check lah. Bleeding in the brain, abnormal blood vessel in the brain, yang ni kena buat further investigation atau imaging investigation baru tahulah biasanya. Serious brain injury can be both start daripada this one, it can occur in kita punya later life ataupun teenagers ataupun adult and also elderly lah. Infection in the brain, meningitis, so daripada mild stroke kadang-kadang boleh pada epilepsy juga. CP, mental disability for instance like ada kaitan dengan like schizophrenia kan, because of imbalance of chemical in the brain will lead to changes dekat dia punya electrical wave in brain lah. So daripada schizo dia experience juga this epilepsy. Seizures occurring within days after head injuries, yang ni kalau ada accident dan sebagainya, then ada seizures, so kena check lah, probably boleh develop permanent epilepsy. Family history of epilepsy and fever related seizures, kalau orang dulu kata di sawan tarik kan, in baby, kalau dia ada experience bahasa kampung ni pun sawan tarik, seizures in infancy tu, dalam umur infant. Alzheimer's disease, lengthy fever related to seizures, alcohol or drug abuse lah. Okay, yang ini dia punya self abuse lah. Okay, orang kata alcohol dan drug tu tak bagus, dia pergi ambil juga. Alright, so in epilepsy dia ada it is proven when we provide withdrawals ataupun dia punya frequency of seizures is reduced lah. Okay, so they start dengan dia modified Atkins, then they have this structured ketogenic diet with different ratio of fat to carbohydrate and protein in gram. So dia adalah this is the most high fat ketogenic. This is yang almost similar to low carbohydrate diet. Okay, ni 40 to 60 gram. Kalau definition of very low carbohydrate diet is 50 kan. Okay, kalau low carbohydrate between 120 to 130 grams. So dia adalah ratio dia. So normally if patient the severe patient, they start dengan this high ratio lah, 4 to 1. Okay, so dia akan calculate lah berapa banyak the small amount of protein and carbohydrate for so biasanya this ketogenic among infant ataupun children ataupun pediatrics, dia punya protein requirement is for dia punya muscle maintenance, carbohydrate is to provide minimal energy, high fat because we want to mimic dia punya ketotic state lah. This is nutritional ketogenic punya state, bukan metabolic ketogenic lah. Okay, yang apa tu insulin resistant dan sebagainya, that is metabolic ketogenic. This is nutritional ketogenic, daripada kita increase dia punya fat content. Okay, alright, so sama juga macam this MCT oil punya diet, most of dia punya fat sources yang kita pakai adalah MCT, because MCT dia punya absorption is different compared to, okay, this is MCT lah. Okay, next is Parkinson's progressive neurological disorder, ability impairment to control voluntary movement, founded by this person lah, John Parkinson. So they name the condition tu as a Parkinson disease. So the famous orang yang ada Parkinson ni siapa, yang boxer tu, Muhammad Ali kan. Okay, so dia punya onset normally is late adult ataupun geriatric lah. So the nutritional aspect of Parkinson disease, because of the tremor, rigidity and stiffness, slowness in movement, motor fluctuation. So this problem will reduce ataupun limit dia punya accessibility to food ataupun dia punya consumption as well lah, bila dia dah tak boleh nak makan kan, because of that issue. Mood changes, bila baru nak suap makanan dan tertumpah, menantu marah, so akan ubah, will deteriorate further lah, dia punya in terms of dia punya food intake. A side effect of certain drugs, so will limit ataupun will lead to nutritional deficiency as well. Okay, insomnia, hallucination, okay, GI disturbance. Identify in the nutrition management, identify the nutritional deficiency or nutrient related problems. So kena screen or do the assessment lah. Minimize practical difficulty associated with eating and swallowing. Monitor nutritional status as disease progress. So kalau macam in terms of dia punya ability to hold or to feed, so kena ada cutleries yang sesuai. So biasanya kita collaborate dengan occupational therapy, macam dia nak design dia punya fork and spoons yang supaya dia senang pegang. Okay, biasanya lighter weight dan sebagainya lah. So that is OT-nya specialized lah. Weight loss, poor intake, swallowing difficulty, tremor, so will lead to this weight loss because of intake. Weight gain because of the medication, dietary implication of drug therapy, and tadilah dry mouth. So again, macam mana you nak modify the food supaya dia tak ada dia punya symptoms of dry mouth tu can be reduced, so dia punya intake can be better. Constipation, cognitive dysfunction, tak ingat dah makan ke belum, pun boleh berlaku. Next is dementia, collective term of condition resulting from destructive pathological changes in brain tissue, lead to progressive loss of intellectual function, which is defined by cognitive and neuropsychological characteristic. Progressive decline in the ability to remember, learn, understand, communication, reasoning, gradual loss of skill including those needed for everyday activities, changes in personality and behavior. Okay. So there are a few classification, Alzheimer, vascular, diffuse Lewy body disease and CJD. Okay. Yang biasa the most prevalent yang melibatkan dementia is Alzheimer disease lah. Okay. Symptoms ada early, ada middle, ada advanced. So early, mild confusion, forgetfulness, words, names, ataupun dia repeat macam I'm not sure lah, macam mungkin you pernah alami ke tak, nak panggil A tapi you sebut nama B, lepas tu sebut nama C, lepas tu yang ketiga baru sebut nama A kan. So it's a mild sign lah, early sign, empty, so have to be aware lah. So kena tak jadi macam ni lah, lone rangers ataupun you not lone rangers. Kadang-kadang lone rangers dia baca banyak pun mungkin tak ada dementia kan. Slowness to grasp idea, unwillingness to try new things. Oh, this is quite tricky kan. increase agitation, low mood, so is a early symptoms lah. Middle short term memory loss become pronounced, lagi ketara, tak ingat kunci letak kat mana kan. Difficulty in understanding and communication, forget recent event or what has just been said or done. So we have to clear our mind, jangan fikir banyak, buat one task at one time. Kadang-kadang bila terlalu banyak kita fikir pun benda-benda pun boleh berlaku. Mother about time, especially kalau if in elderly, kadang kalau orang yang ada this dementia, dia dah confused, dia dah semakan ke belum, ataupun in terms of kita punya nutritional intake, dia dah makan tapi dia terlupa dah makan, minta lagi makan dekat menantu marah, so there's another issue. Fail to recognize people, easily upset, angry. Advanced require is lagi banyak lah daripada middle kan. Little awareness of what is going on, unable to find their way home. Yang ni quite severe lah. Kalau even if you stay at one place for about 3-4 months, biasanya pun kita dah boleh familiar dengan kawasan tu kan. Okay. So kalau you have delayed in engaging dengan that skills, nak pergi, you dah duduk 2 tahun dekat puncak alam tapi nak pergi Tesco pun tak tahu, so mungkin you ada mild atau early symptoms lah. Seems to be searching someone in their past. Yang ini it can be advanced, tapi kalau dalam Islam pun kalau orang tu dia dah sebut orang yang dah lama tak ada pun it's a tanda kan. Okay. Alright. Nutritional implication pun ada, dia adalah in early advanced. So kalau macam early difficulty in shopping, cooking, storing food, hari ni pergi Tesco dah beli cornflakes, minggu depan pergi beli lagi, dah balik rumah ada 4 kotak cornflakes, dah bergaduh husband and wife kan. Failing to recognize spoiled food, okay. Mungkin dari segi physical appearance nampak sama, tapi bila rasa pun rasa macam okey lagi. Yang B, yang mungkin good brain punya function, dah ada, dia can detect something wrong lah. Forgetting to eat, having eaten, eating food which is too hot, pun at early stage of dementia. Okay. Okay, something wrong lah juga. Middle, hooded food in mouth but not swallow, kadang-kadang ada kan, especially in elderly. Food not chewed sufficiently, sama ada it's your habit, because ada je orang yang macam dia tak payah telan, dia tak payah punyah pun masuk mulut
counter tutup 4:30
terus telan kan. Non-food may be eaten, it difference compared to pika. Yang ini dia just because of that degenerative punya issue lah. Food not recognized, refuse to open mouth and turn away when food is offered. Okay. Aphasia or apraxia, and also dysphagia lah. So dysphagia because of dia daripada brain degenerative, dia dah impact kepada the nerves lah, the through swallowing. So dia punya management issue, kalau live alone compared to kalau ada institution punya place, rumah orang-orang tua ke ataupun nursing home. Okay. So as a caregiver, kena treat accordingly. Kalau stay alone, mungkin kena hire nurse ke, kalau like anak mungkin duduk apa tu upstairs ataupun kerja dekat tempat lain, parent yang mak atau ayah, so you have lah punya keep food not require cooking for easy access storing. So so you have to everything into to that elderly ataupun individual with Alzheimer lah. Nanti anak A balik, dia letak makanan kat cupboard A. Anak B balik, macam tak sesuai dekat mata dia susunan tu, so dia pindah ke tempat lain. So yang susahnya orang tua yang tinggal kat rumah is Guillain-Barré syndrome, a rare disorder in which your body's immune system attack your nerves. Weakness and tingling in your hands and feet are usual for the first symptoms. Okay, so it's an autoimmune. Sesiapa pun boleh kena at any age. Tapi the study individual 18 to 35. So it can lead due to infection, JB or immunization. So kalau new vaksin kan,
benda macam ni trigger aku.
Lepas vaksin kena Guillain-Barré pula.
Tak adalah.
This sensation can quickly spread, eventually paralyzing your whole body. So once dia ada these symptoms macam weakness, tingling sensation, so because dia ada banyak overlap sign and symptom in terms of this neuro. So sebelum find out dia punya progression tu is very is rapid. So dalam masa 2-3 bulan kadang-kadang, kalau lambat trigger, lambat dapatkan proper diagnosis, dia boleh paralyze lah. Okay. Acute stage metabolic response is similar to the stress response in neurotrauma. So maksudnya even with this immune attack, the autoimmune, dia punya metabolic changes tu sama macam metabolic stress. Okay, that's why muscle depletion or body store depletion tu very rapid. Daripada orang tu, there's one case, dia agak I can say is overweight, tapi bila after 3 months dia diagnose, dia dah lost about half of dia punya body weight. Okay. So this Guillain-Barré, dia ada issue, dia punya nutrition implication is on nutrition support lah. Okay, sebab dia hypercatabolic. So nutritional intervention must be
patutnya hari Rabu ganti jadi hari Rabu. Patutnya semalam
proper,
dia bagi tahu semalam
kena adequate.
Gerak balik.
Myasthenia Gravis, autoimmune neuromuscular disorders with skeletal muscle that worsen at period of and improves after periods of rest. Okay, these muscles are responsible for function involving breathing, moving parts of body, including arms and legs. So any muscle lah. So ability lah. So dia akan compromise in terms of chewing and swallowing. Tapi kalau after rest, dia okay. Next is multiple sclerosis, chronic inflammation of CNS. This is also autoimmune disease. Attack dia punya myelin dekat nerves. Okay. So that CNS tak boleh function lah. Cause permanent damage or deterioration of the nerves. Compared to Guillain-Barré, multiple sclerosis is slower in Guillain-Barré. Tapi dia punya initial and symptoms is quite same. Sebab tu kalau lama akan much lah dia punya muscle wasting and what not. So these three sclerosis Myasthenia Gravis and Kilan is involved nerves, tapi macam dia melibatkan dia lebih kepada yang ada joint. Okay, kalau compared to kalau Guillain-Barré is and multiple sclerosis di seluruh neurosystem, tapi Guillain-Barré lagi agresif. But the nutritional intervention biasanya in terms of nutrition support tadi lah. Okay. Okay, multiple sclerosis, I think that is the last condition. So yang ni tadilah kita punya the spinal cord, tahulah dia punya link kepada nerve yang mana yang circle, pasti gambar, lepas tu belakang ni coccyx kan, kemudian brain structure, so different part of brain control different functions, can revise in your anatomy in anatomy punya book lah. So issue in MNT in term neurological disorder akan ada dysphagia, so in terms of dia punya swallowing, kemudian milk feeding, eating difficulty, even kalau ada orang prepare the food tapi dia masih depend to carer to feed dan sebagainya lah. Inadequate access in terms of to get the supply ataupun untuk the sources lah. So dysphagia ada kaitan dengan kita punya this swallowing process. So you know in swallowing process there are three phase. Preparatory ataupun oral phase, when you daripada makan tu you chew then make a voice and apa ni, throat area lah. So
Kenapa tu? Kenapa saya hilang? Sehari hilang. Jam, kita gerak-gerak.